Marcus sat in the waiting room of St. Augustine Medical Center, flipping through a magazine without really reading it. His chest had been hurting for the past 2 weeks and the pain was getting worse. At first he thought it was just stress from work. But when the pain started spreading to his left arm, he knew he needed to see a doctor. Marcus was 42 years old and worked as an emergency room doctor at a hospital across town. He had seen hundreds of patients with chest pain, so he knew this could be serious. His father had died of a heart attack at age 50, and his uncle had heart problems too. Heart disease ran in his family, and that scared him. Today was his day off, so he wore jeans and a comfortable sweater instead of his usual work clothes. He had been referred to Dr. Richard Pemberton, who was supposed to be one of the best heart doctors in the city. Marcus hoped he would finally get some answers about what was wrong. A nurse called his name, and Marcus followed her down a long hallway to an exam room. She took his blood pressure and asked him a few basic questions. Then she told him the doctor would be in soon and left him alone in the small room. Marcus waited for about 15 minutes before Dr. Pemberton walked in. He was a white man with silver hair, probably in his early 60s. He wore an expensive-looking suit under his white coat. Everything about him said he was important and successful. "Mr. Chen?" Dr. Pemberton said, looking at his chart. "Actually, it's Dr. Chen," Marcus said politely. "I'm a physician too. I work in emergency medicine at Metropolitan General." Dr. Pemberton's eyebrows went up. He looked Marcus up and down as if seeing him for the first time. "Really, where did you go to medical school?" "Johns Hopkins," Marcus answered. Dr. Pemberton made a small sound, almost like a laugh. "Affirmative action admission, I suppose," he said quietly. But Marcus heard every word. Marcus felt his stomach tighten. He wanted to say something, to defend himself, but he was here as a patient. He needed help. So he kept his face calm and didn't respond to the comment. "So what brings you in today?" Dr. Pemberton asked, sitting down at the computer without looking at Marcus. Marcus explained his symptoms carefully. He had been having chest pain for 2 weeks. The pain was sharp sometimes and dull other times. It got worse when he walked upstairs or exercised. Sometimes it spread to his left arm and jaw. He mentioned that his father had died of a heart attack and that heart disease ran in his family. Dr. Pemberton barely seemed to be listening. He typed a few words into the computer, then turned to look at Marcus with a bored expression. "You people always think every little thing is serious," Dr. Pemberton said. "It's probably just stress."
"Have you been feeling anxious lately?"
Marcus felt confused. "You people?" What did that mean? And why was the doctor dismissing his symptoms so quickly? "I'm concerned about my family history," Marcus said, trying to stay professional. "My father had his first heart attack at 45. I'm 42 now, and these symptoms are—" "Family history doesn't mean you'll have the same problems," Dr. Pemberton interrupted. "You're probably just worried about it, and that's causing anxiety. Anxiety can feel like chest pain." "It's very common," Marcus tried again. "But the pain gets worse with exercise, and it radiates to my arm." "Those are classic signs of—" "I know what the classic signs are," Dr. Pemberton snapped. "I've been doing this for 35 years. You need to trust that I know what I'm doing. Now let me examine you." The examination was quick, too quick. Dr. Pemberton listened to Marcus's heart for maybe 10 seconds. He pressed on Marcus's chest a few times. He didn't do a stress test or order any imaging. The whole physical exam took less than 3 minutes. "Everything sounds normal," Dr. Pemberton said, walking back to his computer. "Like I said, this is probably anxiety. Are you finding your job stressful? Emergency medicine is very demanding. Maybe it's too much for you." Marcus felt his jaw tighten. What did that mean, too much for you? He had been working in emergency medicine for 12 years. He was good at his job. Why was this doctor treating him like he couldn't handle it? "I don't think it's anxiety," Marcus said firmly. "I've had anxiety before. This feels different. This is physical pain, not panic attacks." Dr. Pemberton sighed like Marcus was being difficult. "Look, I understand you're worried. But I'm telling you, based on my examination, this is most likely stress-related. Your lifestyle choices might be contributing to the problem too. Have you been eating well? Getting enough sleep?" Marcus wanted to ask what lifestyle choices meant, but he was afraid he already knew. The comment felt loaded with assumptions about who Marcus was based on the color of his skin. "I eat a healthy diet," Marcus said. "I exercise regularly. I don't smoke or drink much. I'm just concerned about these symptoms." "Well, concern can turn into anxiety very easily," Dr. Pemberton said. He was typing again, not looking at Marcus. I'm going to prescribe you some medication for anxiety. Take it twice a day. Try to relax more. Maybe take some time off work. Your job might be too stressful for you." Marcus couldn't believe what he was hearing. He had come in with serious symptoms and a family history of heart disease. Any competent doctor should at least order an EKG or a stress test. But Dr. Pemberton was sending him home with anxiety pills and telling him his job was too hard for him. "Shouldn't we do some tests?" Marcus asked. "An EKG at least? Maybe a stress test?" Dr. Pemberton looked annoyed. "Those tests are expensive and unnecessary in your case. I've examined you. Your heart sounds fine. You're young and healthy. This is anxiety, not a heart problem. Trust me." But Marcus didn't trust him. Everything about this appointment felt wrong. Dr. Pemberton had barely listened to his symptoms. The examination was rushed and incomplete. The doctor had made strange comments about affirmative action and Marcus's job being too stressful. And now he was refusing to do basic tests that any emergency room would do for a patient with chest pain. Still, Marcus took the prescription. He thanked Dr. Pemberton politely, even though he felt angry and frustrated. He left the exam room and walked through the hospital, his chest still hurting. In the parking lot, Marcus sat in his car for a long time. He looked at the prescription in his hand. Anxiety medication. That's what Dr. Pemberton thought he needed. Not an EKG, not a stress test, not a referral to a specialist. Just pills for anxiety and a suggestion that his job was too hard for him. Marcus thought about the appointment. He had been calm and professional. He had explained his symptoms clearly. He had mentioned his family history multiple times. But Dr. Pemberton had dismissed everything he said. The doctor had spent less than 20 minutes with him total, and most of that time was spent on the computer, not examining him or listening to him. The more Marcus thought about it, the more certain he became that something was very wrong, not just with his heart but with how he had been treated. The comments about affirmative action, the dismissive attitude, the suggestion that his job was too stressful, the refusal to do basic tests. It all added up to something ugly, something Marcus had experienced before in different ways throughout his life. He had been discriminated against. By a doctor, by someone who was supposed to help him, regardless of race or background. By someone who had taken an oath to do no harm. Marcus started his car, but he didn't drive home. Instead, he drove to a different hospital. His chest was still hurting, and he knew something was wrong. He couldn't trust Dr. Pemberton's diagnosis. He needed a second opinion from a doctor who would actually listen to him. As he drove through the city, Marcus felt scared. Not just scared about his health, though, that was part of it. He was also scared about what had just happened. If a doctor could treat him this way, what about other patients? What about people who didn't have medical training and couldn't recognize when they were being dismissed? What about elderly people or poor people who couldn't afford to keep seeking second opinions? Marcus had spent his whole life dealing with racism in different forms. He had learned to stay calm, to be professional, to prove himself over and over again. But this was different. This wasn't just about hurt feelings or unfair treatment. This was about his life. Dr. Pemberton had sent him home with a dangerous condition untreated. If Marcus was right about his symptoms, if this really was his heart, then Dr. Pemberton's negligence could kill him. He gripped the steering wheel tighter and drove faster. He needed to get to the hospital. He needed help. And after he got help, after he found out what was really wrong with him, he would have to decide what to do about Dr. Pemberton. Because if this could happen to him, a doctor with knowledge and resources, what was happening to other patients who looked like him? Marcus pulled into the emergency bay at University Hospital and turned off his car. His chest hurt. His arm ached. But he was still alive, still able to fight for himself. He got out of the car and walked toward the entrance, not knowing that his decision to seek a second opinion would not only save his life, but would eventually change everything. The emergency room at University Hospital was busy, but Marcus didn't have to wait long. He explained his symptoms to the triage nurse, mentioned his family history, and was taken back to an exam room within 15 minutes. The nurse seemed concerned and asked good questions. She took his vital signs carefully and told him a doctor would see him soon. Dr. Sarah Kim came in 10 minutes later. She was a young cardiologist, probably in her late 30s, with kind eyes and a professional manner. She introduced herself and shook Marcus's hand before sitting down to talk. "Tell me what's been going on," she said. And then she did something Dr. Pemberton hadn't done. She listened. Marcus explained everything again. The chest pain, the radiation to his arm, his father's death from a heart attack, his concerns about his family history. Dr. Kim took notes and asked detailed questions. How long did the pain last? What made it better or worse? Did he have any other symptoms like shortness of breath or sweating? I saw another doctor earlier today, Marcus admitted. Dr. Pemberton at St. Augustine Medical Center. He said it was anxiety and gave me this prescription. He showed her the paper. Dr. Kim looked at the prescription, then looked at Marcus with surprise. He didn't order any tests? No, he barely examined me. The whole appointment took maybe 20 minutes. Dr. Kim frowned. Well, let's do this properly. I want to run some tests. We'll start with an EKG, then a stress test. Depending on what we find, we might need to do more imaging. Marcus felt relief wash over him. Finally, someone was taking him seriously. The EKG showed abnormalities right away. Dr. Kim came back into the room looking serious. Marcus, I'm seeing some concerning changes on your EKG. I want to do a stress test now, and I'm also ordering a cardiac catheterization. I think we need to look at your heart arteries directly. Marcus's own medical training told him what that meant. His heart was in trouble, real trouble. The stress test was stopped early because the readings became dangerous. Dr. Kim explained that his heart wasn't getting enough blood during exercise. She ordered an immediate cardiac catheterization, a procedure where they would thread a small camera through his blood vessels to look at his heart. The catheterization showed the truth that Dr. Pemberton had missed. Marcus had severe coronary artery disease. One of his main heart arteries, called the LAD, was 80% blocked. Dr. Kim explained that this artery was sometimes called the widowmaker, because blockages there were so dangerous. You need immediate treatment, Dr. Kim said seriously. We're going to do an angioplasty right now to open up that artery. Marcus, if you had waited, if you had just taken those anxiety pills and gone home, you could have had a massive heart attack at any time. You might have died. Marcus lay on the hospital bed, processing what she was saying. He had been right. His symptoms were real. His concerns were valid, and Dr. Pemberton had sent him home to die. The anger came later, after the procedure was successful, after they had placed a stent in his artery, and he was recovering in a hospital room. Marcus lay there thinking about what had happened. Dr. Pemberton had barely examined him, had dismissed his symptoms, had refused to order basic tests, had sent him away with anxiety medication when he had a life-threatening condition. Why? Why had Dr. Pemberton treated him that way? Marcus knew the answer, even though it made him angry to think it. He had been treated that way because he was black. Dr. Pemberton had seen a black man complaining of chest pain and immediately assumed it was nothing serious. He had made comments about affirmative action and stressful jobs. He had dismissed Marcus's medical training and his family history. He had provided dangerously inadequate care because of prejudice. Dr. Kim came to check on him the next day. Marcus thanked her for saving his life, and then he told her everything about his appointment with Dr. Pemberton. He described the dismissive attitude, the inappropriate comments, the lack of proper examination, the refusal to order tests. Dr. Kim listened with growing concern. When Marcus finished, she was quiet for a moment. I've heard things about Dr. Pemberton before, she finally said. Nothing concrete, just whispers among colleagues. But there have been concerns about how he treats certain patients. You're not the first person to mention problems with him. What do you mean? Marcus asked. I shouldn't say too much, Dr. Kim said carefully, but I've heard from nurses that he's dismissive with black patients. There was talk about a wrongful death lawsuit that the hospital settled quietly a few years ago. And I know other doctors have had concerns, but no one has been willing to formally complain. Marcus felt sick. If other people had noticed the pattern, if there had been concerns before, then why was Dr. Pemberton still practicing? How many other patients had been harmed? You should file a complaint, Dr. Kim said firmly. With the hospital and with the state medical board. What he did to you was negligent at best and discriminatory at worst. You almost died because of his incompetence. Marcus spent the next few days recovering and thinking. He researched Dr. Pemberton online and found he was well connected in the medical community. He served on hospital boards. He had wealthy patients. He had won awards for his work. Complaining about him wouldn't be easy, but Marcus couldn't stop thinking about what Dr. Kim had said. If he didn't speak up, how many other people would be harmed? How many other patients would have their symptoms dismissed? How many would die because Dr. Pemberton couldn't see past the color of their skin? Marcus started making phone calls. He talked to colleagues who worked at St. Augustine Medical Center. He asked careful questions about Dr. Pemberton's reputation. And slowly a picture emerged. A nurse named Jennifer mentioned that Dr. Pemberton often spent less time with black patients than with white patients. "I've noticed it for years," she said quietly, "but I didn't think anyone would believe me if I complained." A social worker named David remembered a case where Dr. Pemberton accused a black patient of drug-seeking behavior, even though the patient had no history of drug use. "The man was clearly in pain," David said, "but Dr. Pemberton wouldn't prescribe adequate pain medication. He said he knew the patient was just trying to get drugs." A hospital administrator, speaking off the record, admitted there had been complaints about Dr. Pemberton over the years. "But he brings in a lot of money for the hospital," the administrator said. "And he has friends on the board. It's hard to discipline someone like that." Marcus realized he needed to do more than just file a complaint. He needed to find other patients who had been harmed. He needed to document the pattern. He needed to build a case so strong that no one could ignore it. He contacted the patient advocacy office at St. Augustine Medical Center and asked if there had been other complaints about Dr. Pemberton. The woman on the phone said she couldn't share that information, but her voice sounded uncomfortable when Marcus explained what had happened to him. Marcus hired a lawyer, a woman named Teresa Banks, who specialized in medical malpractice. She listened to his story and immediately saw the bigger picture. "This isn't just about one bad appointment," Teresa said. "This is about a pattern of discriminatory care. If we can find other patients, if we can document that Dr. Pemberton consistently provides substandard care to black patients, then we have a strong case." Teresa helped Marcus put together a detailed timeline of his appointment with Dr. Pemberton. They documented everything: the dismissive comments, the inadequate examination, the failure to order appropriate tests, the dangerous diagnosis of anxiety when he actually had a life-threatening heart condition. Then they started looking for other patients. Teresa filed public records requests for any lawsuits or complaints against Dr. Pemberton. She found 3 cases that had been settled quietly, all with non-disclosure agreements. But she was able to contact the lawyers who had handled those cases, and through them, she found 3 former patients willing to talk. The first was James Washington, a 55-year-old high school teacher. He had seen Dr. Pemberton 2 years earlier for chest pain. Dr. Pemberton had told him it was probably stress from working in a difficult neighborhood, and had sent him home with advice to relax. 2 months later, James had a massive heart attack while teaching class. He survived, but barely. "I kept thinking about that appointment," James told Marcus when they met. "I described my symptoms clearly. I told him about my family history, but he didn't seem to care. He just assumed I was overreacting." The second patient was Patricia Brown, a 38-year-old lawyer. She had seen Dr. Pemberton for heart palpitations and fatigue. Dr. Pemberton had barely examined her before declaring it was probably menopause, even though Patricia was far too young for menopause. He prescribed her vitamins and told her to get more sleep. 6 months later, another doctor diagnosed her with a heart arrhythmia that required medication and monitoring. "He made me feel crazy," Patricia said, "like I was imagining my symptoms or being dramatic. But I wasn't. There was really something wrong with me. He just didn't believe me." The third patient was Robert Taylor, a 67-year-old retired postal worker. He had seen Dr. Pemberton for follow-up care after a minor heart procedure, but Dr. Pemberton had spent less than 5 minutes with him, hadn't reviewed his test results carefully, and had prescribed the wrong dosage of medication. Robert ended up back in the emergency room a week later with dangerous side effects. "I'm an educated man," Robert said. "I've worked my whole life, but that doctor treated me like I was stupid, like I couldn't understand my own health, and he almost killed me with that wrong prescription." Each patient's story was different in the details, but the same in the pattern. Dr. Pemberton had dismissed their symptoms, provided inadequate care, and made assumptions based on race rather than medical evidence. Marcus compiled all the information into a detailed complaint. He included his own case, the 3 other patients, cases and statements from the nurse and social worker who had witnessed Dr. Pemberton's behavior. He documented the statistics. How much time Dr. Pemberton spent with black patients versus white patients. How often he ordered appropriate tests. How often his diagnoses were later proven wrong. Teresa submitted the complaint to St. Augustine Medical Center's Quality Assurance Department and to the State Medical Board. The complaint was 40 pages long, with medical records, witness statements, and detailed analysis. The hospital responded first, offering Marcus a settlement with a non-disclosure agreement. They would pay him money if he agreed to keep quiet about what happened. Marcus refused immediately. "This isn't about money," he told Teresa. "This is about making sure no one else gets hurt. I want Dr. Pemberton held accountable." The medical board took the complaint seriously. They launched an investigation, interviewing the other patients and reviewing Dr. Pemberton's records. They found more cases that fit the pattern. They discovered that Dr. Pemberton's black patients had significantly worse outcomes than his white patients, even when accounting for other factors. The board scheduled a formal hearing to review Dr. Pemberton's conduct and determine if his medical license should be suspended or revoked. Marcus was told he would need to testify along with the other patients. The hearing would be in 6 weeks. News of the investigation spread through the medical community. Some doctors supported Marcus and praised his courage. Others defended Dr. Pemberton, saying he was being unfairly targeted or that Marcus was playing the race card. Marcus received both support and threats. Someone left an angry voicemail calling him a troublemaker, but he also got calls from other patients thanking him for speaking up, some sharing their own stories of discrimination in healthcare. As the hearing date approached, Marcus felt nervous but determined. He knew this was bigger than just one bad doctor. This was about holding the medical system accountable for racism in healthcare. This was about making sure all patients received equal care regardless of the color of their skin. He prepared his testimony carefully, reviewing all his medical records and notes. He practiced staying calm when talking about painful subjects. He reminded himself why this mattered. The night before the hearing, Marcus couldn't sleep. He kept thinking about Thomas Richards, the patient whose wrongful death lawsuit had been quietly settled. He thought about how many people might have died because Dr. Pemberton's prejudice prevented him from providing adequate care. Marcus knew the hearing could change everything, not just for Dr. Pemberton, but for how the hospital addressed discrimination going forward. He was ready. The morning of the hearing was cold and gray. Marcus woke up early, too nervous to sleep. He put on his best navy blue suit and a red tie. He wanted to look professional, credible, like someone the board would believe. He checked his folder one more time, making sure all his documents were organized. Medical records, test results, notes from his appointment with Dr. Pemberton. Everything was ready. He arrived at St. Augustine Medical Center 30 minutes before the hearing was scheduled to start. The meeting was being held in the hospital's largest conference room on the 3rd floor. Marcus took the elevator up, his heart beating fast. This was it. This was the moment that would determine if Dr. Pemberton would be held accountable. The conference room was already filling with people when Marcus arrived. There were 7 board members sitting at a long table at the front of the room. Marcus recognized Dr. Elizabeth Harper, who was leading the hearing. She was a well-respected cancer doctor known for being fair and thorough. The other board members included doctors from other hospitals, a nurse administrator, a community representative, and a professor who taught medical ethics. Hospital administrators sat along one wall, all wearing serious expressions. Representatives from the State Medical Board were there too, taking notes. A court reporter sat in the corner, ready to record everything that was said. Marcus saw the 3 other patients sitting together near the back. James Washington gave him a small nod. Patricia Brown looked nervous, twisting her hands in her lap. Robert Taylor sat very still, his face calm but his eyes alert. They had all agreed to testify about their experiences with Dr. Pemberton. Then Dr. Pemberton walked in with his lawyer. Pemberton wore an expensive gray suit and walked with confidence like he owned the room. His lawyer was a man named Gerald Hutchins, who was famous for defending doctors in malpractice cases. Pemberton, nodded to some of the board members who he clearly knew. He didn't look worried at all. Marcus felt his anger rise. Pemberton acted like this was just a minor inconvenience, like he was certain he would be cleared of any wrongdoing. He sat down at a table facing the board, leaning back in his chair casually. Dr. Harper called the meeting to order. Her voice was clear and professional. She explained that this was a formal hearing to investigate complaints about Dr. Pemberton's medical care. The board would hear evidence, listen to testimony, and then make recommendations about whether Dr. Pemberton should face any consequences. This hearing is being recorded, Dr. Harper said. Everything said here today will be part of the official record. We will start with the hospital's investigation findings, then Dr. Pemberton will have a chance to respond, and then we will hear from patients and witnesses. The hospital's chief medical officer, Dr. Raymond Foster, stood up to present the investigation findings. He was a tall man with gray hair and glasses. He looked uncomfortable, like he didn't want to be there. Dr. Foster explained that the hospital had reviewed 2 years of Dr. Pemberton's patient records after receiving Marcus's complaint. They had looked at hundreds of patient files, comparing how Dr. Pemberton treated white patients versus black patients. The findings are significant, Dr. Foster said. He pulled up a chart on a large screen. On average, Dr. Pemberton spent 40% less time with black patients compared to white patients with similar symptoms. His notes for black patients were shorter and less detailed, and he ordered appropriate diagnostic tests at significantly lower rates for black patients. The chart showed clear differences. For white patients with chest pain, Dr. Pemberton ordered EKGs 90% of the time. For black patients with the same symptoms, he ordered EKGs only 40% of the time. The pattern was the same for stress tests, imaging, and referrals to other specialists. Additionally, Dr. Foster continued, black patients under Dr. Pemberton's care had worse outcomes. They were more likely to end up in the emergency room within 30 days. They were more likely to be readmitted to the hospital, and they had higher rates of serious complications. Marcus watched the board members as they studied the charts. Some were leaning forward, looking closely at the numbers. Others were taking notes. Dr. Harper's face was serious and focused. Dr. Pemberton's lawyer stood up quickly. I object to this presentation, Gerald Hutchins said. Statistics can be twisted to show anything. There could be many reasons for these differences that have nothing to do with race. Maybe black patients had more complicated health problems. Maybe they didn't follow doctor's orders. You can't just assume discrimination based on numbers. Dr. Harper looked at him calmly. Your objection is noted, Mr. Hutchins, but this board will review all the evidence and make our own conclusions. Please sit down. Hutchins sat down, but he looked angry. Dr. Pemberton whispered something to him. Dr. Foster continued his presentation. He brought up specific cases, including Marcus's appointment. On the screen, he showed the notes from Marcus's visit. They were incredibly short, just 4 sentences describing a 20-minute appointment. No family history mentioned, no detailed cardiac examination documented, just a prescription for anxiety medication. For comparison, Dr. Foster said, here are Dr. Pemberton's notes from an appointment with a white patient on the same day with similar symptoms. The difference was shocking. The second set of notes was 3 full pages. Detailed history, complete physical examination, family history carefully documented, multiple tests ordered. The 2 patients had come in with almost identical symptoms, but they had received completely different care. Several board members exchanged glances. One woman shook her head slightly as if she couldn't believe what she was seeing. Then Dr. Foster said something that made the entire room go silent. We also have audio recordings from some of Dr. Pemberton's appointments. Marcus's head snapped up. Audio recordings? He hadn't known about this. Dr. Foster explained that St. Augustine Medical Center, like many hospitals, recorded certain appointments for quality assurance. Patients gave consent when they signed in at registration, though most people didn't notice the small print. The recordings were stored in a digital system that most doctors forgot about. We're going to play a recording from Dr. Chen's appointment with Dr. Pemberton, Dr. Foster said. The room was completely quiet as the recording started. Marcus heard his own voice explaining his symptoms. He sounded calm and professional, clearly describing his chest pain, his family history, and his concerns. Then he heard Dr. Pemberton's voice, and it was worse than Marcus remembered. The condescending tone was obvious. The dismissive comments were clear. The interruptions were frequent. Everyone in the room could hear Dr. Pemberton questioning Marcus's medical school admission, suggesting his job was too stressful, telling him, "You people always think every little thing is serious." Some board members looked uncomfortable. One man took off his glasses and rubbed his eyes. Dr. Harper's jaw was tight. When the recording ended, Dr. Foster let the silence sit for a moment. Then he said, "We have other recordings as well. This one is from 3 weeks after Dr. Chen's appointment." The next recording was even worse. The patient was an elderly black man named Thomas Richards. Marcus had heard about this case. Thomas Richards had died of a heart attack the same day as this appointment. On the recording, Thomas Richards described severe chest pain that went down his arm. His voice was strained like he was in real pain, but Dr. Pemberton's response was harsh and dismissive. "Mr. Richards, I think you're exaggerating your symptoms to get pain medication," Dr. Pemberton said on the recording. "I see this all the time. You need to stop wasting my time and go home." Marcus felt sick listening to it. That man had been having a heart attack, and Dr. Pemberton had accused him of drug-seeking behavior. Thomas Richards had died just hours after leaving the hospital. The room was completely silent when the recording ended. Several people looked shocked. Patricia Brown was crying quietly in the back row. Dr. Pemberton's confident expression had changed. He looked pale and shaken. Dr. Foster finished his presentation by explaining that the hospital had found a pattern of discriminatory care spanning several years. "This is not about 1 or 2 mistakes," he said. "This is a systematic pattern of providing substandard care to black patients based on racial prejudice." Dr. Harper called for a 15-minute break. People stood up and started talking in low voices. Marcus stepped outside to get some air. His hands were shaking. Hearing those recordings had been harder than he expected. He had relived his own appointment, and he had heard a man begging for help just hours before he died. James Washington came outside and stood next to Marcus. "That recording," James said quietly, "that could have been any of us. That man died because the doctor didn't believe him." "I know," Marcus said. "That's why we're here. That's why this matters." After 15 minutes, everyone returned to the conference room. Dr. Harper looked directly at Dr. Pemberton. "Dr. Pemberton, you now have the opportunity to respond to these findings. Would you like to make a statement?" Dr. Pemberton stood up. His lawyer had clearly coached him on what to say. He buttoned his jacket and cleared his throat. "Thank you, Dr. Harper," he began. His voice was steady, but Marcus could see his hands shaking slightly. "I have been a doctor for 35 years. I have treated thousands of patients from every background imaginable. The suggestions made here today are not only false but deeply offensive to me and to everything I have worked for." He went on to defend himself, arguing that the statistics were misleading. He claimed that black patients often had more complicated health problems because of poverty and lifestyle factors. He said his documentation style varied based on how complex each case was, not based on race. He insisted that his treatment of Marcus was appropriate at the time. Dr. Chen came in with vague symptoms, Pemberton said. He was clearly stressed about his job. Anxiety was a reasonable diagnosis. The fact that another doctor later found something different doesn't mean I was wrong. It means medicine is complicated and symptoms can change. When asked about the audio recordings, Pemberton looked less confident. "Those recordings don't show the full context," he said. "They're just small pieces of longer conversations. My tone might have been firm, but sometimes doctors need to be direct with patients." His explanation about Thomas Richards was even weaker. Mr. Richards had a documented history of drug-seeking behavior in his medical file, Pemberton claimed. "I had to use my clinical judgment to determine if he was having a real emergency or trying to get pain medication. It's a difficult decision that doctors face every day." Marcus wanted to shout that Thomas Richards had been having a heart attack, that any competent doctor should have recognized the symptoms. But he stayed quiet. He would have his chance to speak soon. Dr. Pemberton's lawyer added that his client had never been disciplined before, that he had a long career of good work, and that this seemed like an unfair attack by people with an agenda. "Dr. Pemberton is a respected member of this community," the lawyer said. "He brings in significant revenue for this hospital. He has friends on the board. These complaints seem designed to damage his reputation rather than address any real problems. Dr. Harper listened to everything without expression. When they finished, she thanked them and said it was time to hear from the patients. "Dr. Chen," she said, looking at Marcus, "would you please come forward and tell us about your experience?" Marcus stood up. This was his moment. He walked to the front of the room carrying his folder. He placed it on the table and looked at the board members. Then he began to speak, telling his story in a clear, calm voice. He explained who he was, his medical training, and why he had gone to see Dr. Pemberton. He described the appointment in detail, including the inappropriate comments about affirmative action and the suggestion that his job was too stressful for him. He explained how Dr. Pemberton had dismissed his symptoms and refused to order basic tests. "I remained calm during that appointment," Marcus said, "because I was raised to believe that dignity in the face of disrespect is a form of strength. But I also stayed calm because I was a patient seeking help, and I hoped that professionalism would matter more than prejudice. I was wrong." He showed the board his medical records from both appointments, pointing out what Dr. Pemberton had missed. He explained that Dr. Kim had found a life-threatening condition within an hour of meeting him, while Dr. Pemberton had spent 20 minutes dismissing his concerns. "I had an 80% blockage in my main heart artery," Marcus said. "Dr. Pemberton sent me home with anxiety medication. If I had followed only his advice, I would probably be dead right now." The room was completely quiet. Everyone was listening to every word Marcus said. Marcus continued speaking, his voice steady and clear. He looked directly at the board members as he talked, making sure they understood the full impact of what had happened. "After I recovered from my surgery, I started asking questions," Marcus said. "I talked to people who worked at this hospital, and I discovered something disturbing. I wasn't the only patient who had this experience with Dr. Pemberton. There was a pattern." He described how he had found the other patients, how their stories were all similar: dismissed symptoms, inadequate examinations, dangerous misdiagnoses, and all of them were black patients. "This isn't about one doctor having a bad day," Marcus said. "This is about systematic discrimination that puts lives at risk. Thomas Richards died because Dr. Pemberton didn't believe him. I almost died for the same reason. How many other people has Dr. Pemberton harmed?" Marcus paused and looked at Dr. Pemberton directly. The older doctor wouldn't meet his eyes. "As a physician myself, I took an oath to do no harm," Marcus said. "That oath doesn't have exceptions. It doesn't say to do no harm to some patients, but not others. Every patient deserves thorough care regardless of their race. Dr. Pemberton violated that oath repeatedly, and the evidence shows it wasn't an accident. It was prejudice." When Marcus finished, Dr. Harper asked if Dr. Pemberton's lawyer wanted to ask questions. Gerald Hutchins stood up, trying to discredit Marcus's testimony. "Dr. Chen, isn't it possible you misunderstood Dr. Pemberton's communication style?" Hutchins asked. "Maybe cultural differences made you interpret his words differently than he intended them." Marcus kept his voice calm. "I've been black my entire life, Mr. Hutchins. I know what racism sounds like. This wasn't a misunderstanding. Dr. Pemberton questioned my education, dismissed my symptoms, and provided dangerously inadequate care because of my race." "But you can't prove that," Hutchins argued. "You're just assuming Dr. Pemberton's motivations." "The audio recording proves it," Marcus replied. "Everyone in this room heard him question my medical school admission and suggest my job was too stressful. Those comments were based on race, not on medical evidence. And the pattern of his care, shown in the statistics, confirms what I experienced personally." Hutchins tried several more questions, but Marcus answered each one clearly and firmly. He had prepared well, and he wasn't going to be shaken from his story. Finally, Hutchins sat down, looking frustrated. Dr. Harper thanked Marcus and asked him to sit. Then she called James Washington forward. James walked to the front slowly. He was a big man, tall and broad-shouldered, but he looked nervous. He explained that he was a high school teacher, married with 2 teenage children. 2 years ago, he had started having chest pains. "I went to Dr. Pemberton because my insurance said he was in my network," James said. "I told him about my symptoms. Sharp pains in my chest, sometimes going down my arm. My father had died of a heart attack, so I was worried." James described how Dr. Pemberton had barely listened to him. The doctor had asked where James worked, and when James said he taught at a high school in a mostly black neighborhood, Dr. Pemberton had made assumptions. He said my chest pain was probably stress from working in such a difficult environment, James said. He made it sound like teaching black kids was some kind of impossible job. He didn't take my symptoms seriously at all. Dr. Pemberton had done a quick examination and sent James home with advice to relax and reduce stress. No EKG, no stress test, no follow-up appointment scheduled. 2 months later, I was teaching my history class when I felt the worst pain of my life, James said. His voice got quiet. I collapsed right there in front of my students. One of my kids had to call 911. They were so scared seeing their teacher on the floor, not knowing if I was going to die. James explained that he had been having a massive heart attack. Emergency surgery saved his life, but the damage to his heart was severe. He had to take medical leave from work for 3 months. Even now, 2 years later, he got tired easily and couldn't do everything he used to do. My daughter had nightmares for months, James said, his voice breaking. She was so scared I was going to die. And the thing is, if Dr. Pemberton had just done his job, if he had ordered simple tests like an EKG, they might have caught the problem before it got so bad. James looked at Dr. Pemberton with anger in his eyes. You saw a black man complaining of chest pain and you decided I was just stressed. You didn't see me as a person with a real medical problem. You saw my race first and you let that cloud your judgment. And I almost died because of it. When James sat down, several people in the room were wiping their eyes. His testimony had been powerful and emotional. Even some of the board members looked upset. Dr. Harper called Patricia Brown next. Patricia was younger, only 38 years old, and she looked professional in her dark blue dress. She explained that she was a lawyer at a downtown firm. 3 years ago, I started having heart palpitations, Patricia said. My heart would suddenly race for no reason. I felt dizzy and tired all the time. I knew something was wrong. She had gone to Dr. Pemberton on the recommendation of a colleague. But from the moment she walked in, the appointment felt wrong. He kept interrupting me, Patricia said. I was trying to explain my symptoms, but he kept cutting me off. Finally, he said it was probably menopause and I should take vitamins. Patricia had been confused. She was only 35 at the time, far too young for menopause. She had tried to explain this, but Dr. Pemberton had dismissed her concerns. He said black women often go through menopause early, Patricia said. He made it sound like a fact, but it's not true. He was making assumptions based on stereotypes, not on medical knowledge. Dr. Pemberton had barely examined her. He hadn't ordered any heart tests. He had prescribed vitamins and told her to get more sleep. I felt crazy, Patricia said, like I was imagining my symptoms or being dramatic. But the palpitations kept getting worse. Finally, 6 months later, I went to a different doctor. She took me seriously. She ordered an EKG and found that I have a heart arrhythmia. It's a real medical condition that needs medication and monitoring. Patricia explained that the delay in diagnosis had been dangerous. Her condition could have caused a stroke or heart attack. She now had to take medication every day and see a cardiologist regularly. Dr. Pemberton made me doubt myself, Patricia said. He made me feel like my concerns weren't valid. But they were valid. I had a serious medical condition, and he missed it because he didn't take the time to actually examine me or listen to me. When Patricia finished, Dr. Pemberton's lawyer tried to ask her questions, but she answered with the confidence of someone who argued cases for a living. She wasn't going to be intimidated. Finally, Dr. Harper called Robert Taylor. Robert was the oldest of the patients, 67 years old, with gray hair and tired eyes. He walked slowly to the front of the room. Robert explained that he was retired from the Postal Service. He had worked for 30 years delivering mail before retiring 5 years ago. He had gone to Dr. Pemberton for follow-up care after having a stent placed in one of his heart arteries. The surgery went well, Robert said, but I needed to see a cardiologist regularly to make sure everything was healing properly. My first doctor had retired, so I was referred to Dr. Pemberton. Robert described his first appointment. Dr. Pemberton had spent less than 5 minutes with him. He had glanced at Robert's test results but hadn't reviewed them carefully. He had prescribed medication and sent Robert on his way. The problem was he prescribed the wrong dosage, Robert said. The medication was supposed to be 5 milligrams, but he prescribed 50 milligrams. That's 10 times too much. Robert had taken the medication as directed, trusting that his doctor knew what he was doing. Within a week, he was back in the emergency room with dangerous side effects. His blood pressure had dropped so low he could barely stand up. He was dizzy, confused, and felt like he was going to pass out. The emergency room doctor caught the mistake right away, Robert said. He asked who had prescribed such a high dosage. When I said Dr. Pemberton, he just shook his head. He told me I was lucky I hadn't had a stroke or heart attack from that medication error. Robert had filed a complaint with the hospital at the time, but nothing had happened. He was told that medication errors happen sometimes and that Dr. Pemberton would be more careful in the future. But I don't think it was just an error, Robert said quietly. I think Dr. Pemberton didn't pay attention to my case because he didn't think I was important. He spent 5 minutes with me. 5 minutes to review complex test results and prescribe important medication. He didn't care enough to be careful. Robert looked at the board members. I've lived through Jim Crow laws. I've seen discrimination in every form you can imagine. I thought things were better now. I thought doctors, of all people, would be above that kind of prejudice. But I was wrong. Racism is still alive, even in medicine. His words hung in the air. Robert sat down slowly, his testimony complete. Dr. Harper announced that they would take another break. Marcus stood up and stretched, feeling emotionally drained. The testimonies had been powerful but also painful to hear. Each patient's story was a reminder of the harm that prejudice could cause. During the break, Marcus talked with the other patients. They were all feeling the same mixture of relief and exhaustion. They had told their stories. They had been heard. Now it was up to the board to decide what to do. When everyone returned to the conference room, Dr. Harper explained that they would now hear from witnesses who had seen Dr. Pemberton's behavior at the hospital. A nurse named Jennifer Chen came forward. She was a middle-aged woman who had worked at St. Augustine Medical Center for 15 years. She looked nervous but determined. I've worked with Dr. Pemberton for a long time, Jennifer said, and I've noticed things. He treats black patients differently than white patients. He spends less time with them. He's less patient when they ask questions, and he's quicker to dismiss their symptoms. Jennifer described specific incidents she had witnessed. She talked about times when Dr. Pemberton had made inappropriate comments about patients. She mentioned how uncomfortable she had felt but hadn't known how to report it. I'm ashamed to say I didn't speak up sooner, Jennifer said. I was worried about my job. Dr. Pemberton has powerful friends at this hospital, but I can't stay quiet anymore. What he's been doing is wrong, and it's been putting patients in danger. A social worker named David Martinez testified next. He had worked with Dr. Pemberton's patients and had seen concerning patterns. I noticed that Dr. Pemberton's black patients seemed more confused and frustrated after their appointments, David said. They would tell me the doctor hadn't explained things clearly or hadn't listened to their concerns. At first I thought maybe they were just difficult patients, but after seeing it happen over and over, I realized the problem was the doctor, not the patients. The testimonies painted a clear picture, multiple witnesses from different perspectives, all describing the same pattern of discriminatory behavior. Dr. Pemberton's lawyer tried to argue that these witnesses were biased or had misunderstood what they saw. But their testimonies were consistent and detailed. They had specific examples and dates. They had documentation. As the testimony portion of the hearing ended, Marcus felt a mixture of emotions. He was glad they had all spoken up. He was proud of the other patients for having the courage to tell their stories. But he was also sad that it had come to this, that a doctor had harmed so many people before being held accountable. Dr. Harper announced that the board would need time to review all the evidence and deliberate. They would take a 1-hour break and then return with their decision. The waiting began. Marcus paced in the hallway, too nervous to sit still. James, Patricia, and Robert sat together on a bench, talking quietly. Hospital administrators huddled in groups, whispering about what the board might decide. Dr. Pemberton sat alone with his lawyer in a corner. For the first time, he didn't look confident. He looked worried, even scared. The weight of all the testimony, all the evidence, seemed to have finally gotten to him. Marcus checked his watch repeatedly. The hour felt like the longest of his life. He thought about everything that had been said, everything that had been revealed. The statistics, the audio recordings, the testimonies. It was overwhelming evidence of systematic discrimination. But would it be enough? Would the board have the courage to hold a powerful, well-connected doctor accountable? Or would they find a way to minimize the evidence and protect one of their own? Marcus didn't know. All he could do was wait and hope that justice would be served. The hour passed slowly. Marcus walked up and down the hallway, his mind racing. He couldn't stop thinking about Thomas Richards, the man who had died after Dr. Pemberton dismissed his symptoms. That death could have been prevented. Marcus's own near-death experience could have been prevented. How many other patients were out there who had been harmed? Jennifer, the colleague who had come to support Marcus, brought him a cup of coffee. "You did the right thing," she said quietly. "No matter what happens in there, you stood up for what's right." Marcus nodded but couldn't speak. His throat felt tight with emotion. Finally, after what felt like forever, the doors to the conference room opened. Dr. Harper's assistant announced that the board was ready. Everyone filed back inside, finding their seats. The atmosphere felt heavy, like something important was about to happen. Dr. Harper sat at the center of the panel table. She had papers in front of her and looked serious. The other board members sat on either side of her, their faces unreadable. Marcus felt his heart pounding in his chest. Dr. Harper looked around the room slowly, making eye contact with different people. When she spoke, her voice was clear and strong. "This board has carefully reviewed all the evidence presented today," she began. "We have looked at the statistical analysis of Dr. Pemberton's patient records. We have listened to the audio recordings from his appointments. We have heard testimony from patients and witnesses. We have also reviewed Dr. Pemberton's personnel file and his history at this hospital." She paused, and the silence in the room was complete. Everyone was holding their breath. "What we have found is deeply disturbing," Dr. Harper continued. "The evidence shows a clear pattern of discriminatory treatment based on race. This is not a case of misunderstanding or honest mistakes. This is systematic bias that has resulted in substandard medical care, and in at least one documented case, preventable death." Marcus felt relief beginning to wash over him. The board believed them. They saw the pattern. Dr. Harper continued, her voice getting stronger. "The audio recordings alone demonstrate serious violations of professional ethics. Dr. Pemberton's dismissal of Mr. Richards' symptoms was not just poor judgment. It was negligence that directly led to that patient's death. Dr. Chen's case shows the same dangerous pattern. A physician came to Dr. Pemberton with concerning symptoms and clear family history, and instead of providing adequate care, Dr. Pemberton made assumptions based on race and sent a patient home with a life-threatening condition. She looked directly at Dr. Pemberton. The older doctor's face had gone pale. "Dr. Pemberton, the board's findings are as follows," Dr. Harper said formally. "You have demonstrated a pattern of racial bias that has compromised patient care. You have violated fundamental principles of medical ethics. You have endangered lives through inadequate examination and treatment. Therefore, this board recommends immediate suspension of your hospital privileges, pending a full investigation by the state medical board." The room erupted with noise. Some people gasped. Dr. Pemberton's supporters looked shocked. His lawyer started to stand up, but Dr. Harper held up her hand. "I'm not finished," she said loudly. The room fell silent again. Marcus leaned forward. "What else was there?" Dr. Harper's expression became even more serious. "During our investigation, we discovered information that changes the nature of these proceedings entirely." Marcus felt confused. "What information?" He glanced at the other patients, who looked equally puzzled. "We found that this is not the first time Dr. Pemberton's conduct has been questioned," Dr. Harper said. "In fact, there have been 5 formal complaints filed against him over the past 8 years. All from patients of color, all alleging discriminatory treatment and substandard care." The shock in the room was visible. Marcus's mouth fell open. 5 complaints? And he had never heard about any of them? Dr. Harper picked up a thick folder. "These complaints were filed with the hospital's patient advocacy department, but they were never properly investigated. In fact, they were systematically dismissed or minimized. The complaints were not forwarded to the state medical board as required by law. Instead, they were filed away and marked as resolved." The hospital administrators looked stunned. Dr. Foster, who had presented the investigation findings, appeared shocked. He clearly hadn't known about this. "The person responsible for handling these complaints," Dr. Harper said, and her voice was cold now, "was the former director of patient advocacy, Margaret Pemberton, Dr. Pemberton's wife." The gasp that went through the room was loud. Marcus felt like he had been punched in the stomach. Dr. Pemberton's wife had been covering up complaints about him for 8 years. The conflict of interest was enormous, the betrayal of patients profound. Dr. Harper didn't stop. "Mrs. Pemberton retired 6 months ago. Her replacement discovered these buried complaints during a routine audit of old files. The new director brought this to the administration's attention 2 weeks ago, and the information was shared with this board yesterday evening. She held up the thick folder so everyone could see it. We have documentation showing multiple instances where patients reported discriminatory treatment, inadequate care, and dismissive behavior. In every case, Mrs. Pemberton closed the complaint without proper investigation. Some patients were told they had misunderstood the doctor. Others were offered small amounts of money if they agreed to sign papers saying they wouldn't talk about their experience. None of them were told they had the right to file complaints with outside agencies. Marcus felt sick. How many patients had tried to report Dr. Pemberton and been silenced? How many people had suffered because complaints were buried? Dr. Harper's face was severe. This represents not just individual misconduct by Dr. Pemberton, but systematic institutional failure. This hospital allowed a clear conflict of interest to exist for years. Even when patients tried to report problems, they were silenced by a system designed to protect the physician instead of serving patients. She turned to face Marcus and the other patients directly. I want to apologize to all of you. This institution failed you. We should have caught this pattern years ago. We should have had safeguards in place to prevent one person from burying complaints about their own spouse. We should have listened when patients tried to tell us something was wrong. We failed and people were hurt. Thomas Richards died because of our failure. The weight of her words filled the room. Hospital administrators looked horrified. The legal implications were massive. This wasn't just about one bad doctor anymore. It was about an entire system that had protected him and silenced his victims. Dr. Harper took a breath and continued with the board's recommendations. First, Dr. Pemberton's hospital privileges are immediately suspended. Second, we are referring this matter to the State Medical Board with a strong recommendation for license suspension or revocation. Third, we are referring this matter to the District Attorney's Office for possible criminal investigation regarding the cover-up of complaints. Dr. Pemberton suddenly stood up, his chair scraping loudly. His lawyer grabbed his arm, trying to make him sit down, but Dr. Pemberton shook him off. He looked like he wanted to say something to defend himself, but then his shoulders slumped and he sat back down heavily, putting his face in his hands. Dr. Harper wasn't finished with her recommendations. Fourth, St. Augustine Medical Center must conduct a complete review of its patient advocacy and complaint procedures. Fifth, the hospital must audit patient outcomes for people of color across all departments to identify any other patterns of discriminatory care. Sixth, mandatory training on implicit bias should be required for all medical staff, and this training must be repeated annually. She closed her folder with finality. This hearing is adjourned. The full written findings will be available within 1 week. This board takes patient safety seriously, and we will not tolerate discrimination in medical care. The room slowly began to empty. People stood up talking in hushed voices. Marcus sat still for a moment, letting everything sink in. They had won. Dr. Pemberton was being held accountable, but the victory felt bittersweet because of what they had learned about the buried complaints. James Washington came over and shook Marcus's hand firmly. 5 other complaints, he said, his voice tight with anger. 5 other patients tried to speak up and they were silenced. If just one of those complaints had been taken seriously, Thomas Richards might still be alive. I might not have had my heart attack. Patricia Brown was crying, but they were tears of relief mixed with anger. All those years, she said. Patients were trying to tell people what was happening, and his wife made sure no one would listen. Robert Taylor stood quietly, looking at Dr. Pemberton, who was still sitting with his face in his hands. That's what racism looks like in action, Robert said. Not just one person's prejudice, but a whole system designed to protect that prejudice and punish anyone who tries to challenge it. Marcus watched as hospital administrators gathered in worried clusters. They knew the legal trouble the hospital was now facing. Buried complaints, systematic cover-ups, a wrongful death. The lawsuits would be massive. Dr. Pemberton finally stood up and left with his lawyer. He looked 20 years older than when the hearing had started. His confident walk was gone, replaced by a defeated shuffle. As he passed Marcus, he didn't make eye contact. Over the next few days, the story exploded. Local news covered it first, then national media picked it up. Doctor suspended after years of racial bias, read one headline. Hospital covered up discrimination complaints for 8 years, read another. The story resonated because it confirmed what many people of color already knew. Racial bias in healthcare was real, it was dangerous, and institutions often protected it instead of stopping it. Dr. Pemberton's lawyer released a statement saying his client denied wrongdoing and planned to appeal. But the statement was weak. The audio recordings were public now. The statistics were clear. The buried complaints had been revealed. No amount of legal maneuvering could change those facts. Within a week, Dr. Pemberton resigned from St. Augustine Medical Center. The statement said he was pursuing other opportunities, but everyone knew what it really meant. He was being forced out. The state medical board moved quickly, temporarily suspending his medical license while they conducted their own investigation. The district attorney's office opened a criminal investigation into Margaret Pemberton's handling of the complaints. She could potentially face charges for obstruction of justice. The hospital's insurance company began reviewing all the cases that had been quietly settled over the years, trying to determine how much money they might owe to patients who had been harmed and then silenced. For Marcus, returning to work at his own hospital felt strange. His colleagues treated him differently now. Some called him brave. Others avoided talking about what happened, uncomfortable with the racial issues it raised. He received hundreds of messages from other doctors of color, sharing their own experiences with discrimination. 3 weeks after the hearing, Marcus was invited to speak at a major medical conference about racial bias in healthcare. Standing in front of 200 doctors and nurses, he told his story again. "I'm lucky," he said. "I had medical knowledge. I had resources. I had professional credibility that made people take me seriously. But what about patients who don't have those advantages? What about the elderly grandmother who completely trusts her doctor? What about the young parent who can't afford to keep getting second opinions? What about people who have been taught by society to doubt themselves when they face discrimination?" He paused, looking out at the audience. Thomas Richards died because a doctor didn't believe him. How many other people are dying right now because their pain is being dismissed? How many are suffering because doctors see their race before they see their symptoms? The room was silent. Marcus saw some people crying. Others were nodding, recognizing the truth in his words. "The answer isn't simple," Marcus continued. "We need better training. We need better policies, but most importantly, we need to examine our own biases and commit to treating every patient with equal care. We need systems where patients can report problems without being silenced. We need to listen when people tell us they're being harmed." The speech was recorded and shared widely. Medical schools began using Marcus's case as an example in their courses. Hospitals started reviewing their own complaint procedures to make sure nothing like Margaret Pemberton's cover-up could happen at their institutions. 6 months after the hearing, St. Augustine Medical Center released results from their full audit. The findings were disturbing. Black and Hispanic patients received less thorough care across multiple departments. They got fewer referrals to specialists. They received less aggressive pain treatment. The disparities were clear and undeniable. The hospital implemented major reforms. They created an independent patient advocacy office with oversight from community members. They required all doctors to complete comprehensive bias training. They started conducting regular audits of patient outcomes by race. They established a diverse oversight board that included patients and community representatives. Other hospitals in the region began conducting similar audits. Medical boards in several states tightened their complaint investigation procedures. Medical schools revised their programs to include more education about health disparities and cultural awareness. Patricia Brown started a patient advocacy organization called Heard and Healed. The group helped people of color navigate the healthcare system and taught them how to report discrimination. Within a year, they had helped dozens of patients file complaints and get the care they deserved. James Washington returned to teaching, but now he talked to his students about health equity. He taught them to be advocates for themselves and their families, to speak up when something felt wrong, to get second opinions if they weren't being heard. Robert Taylor became a volunteer health advisor in his community. He visited churches and senior centers, sharing his story and empowering others to demand respectful treatment from their doctors. Marcus continued his emergency medicine work, but he was changed. He watched more carefully how doctors interacted with patients of color. He spoke up when he saw concerning patterns. He mentored young doctors, especially those from minority backgrounds. helping them navigate a medical system that wasn't always designed with them in mind. Nearly a year after the hearing, Marcus received a letter that made him cry. It was from Angela Richards, Thomas Richards' daughter. "For so long I blamed myself for my father's death," she wrote. "I thought I should have forced him to go to a different hospital. I thought I should have questioned the doctor more. But you helped me understand that my father's death wasn't our family's failure. It was Dr. Pemberton's failure, and the hospital's failure for protecting him. You gave us justice. You gave us answers. And you might have saved other families from the same pain we went through. Thank you." Marcus kept that letter in the folder with all his other documents from the case. On difficult days when he felt discouraged about how much still needed to change, he would read Angela's words and remember why the fight mattered. 1 year after the hearing, Marcus stood in his emergency room examining a young black man who had come in complaining of chest pain. The patient, Deshaun, was only 28 years old but seemed frightened. "I'm probably just being paranoid," Deshaun said, looking embarrassed. "My girlfriend said I should come in, but it's probably nothing serious." Marcus recognized that tone. It was the voice of someone who had learned not to trust his own pain, someone who expected to be dismissed. Marcus had heard that same doubt in his own voice a year ago when he had gone to see Dr. Pemberton. "Tell me exactly what you're feeling," Marcus said, pulling up a chair to sit at eye level with his patient. "And don't worry about whether it seems serious to you. That's my job to figure out. Your job is to tell me everything, okay?" Deshaun relaxed a little and described his symptoms. Sharp pains in his chest that came and went. Sometimes they spread to his shoulder. He had been ignoring them for a week because he didn't want to be dramatic. Marcus listened carefully to every word. He asked detailed questions. He performed a thorough examination. He ordered an EKG, blood tests, and a chest X-ray. He didn't rush. He didn't dismiss, he didn't make assumptions. The tests came back normal, which was good news. Deshaun's chest pain was likely from a pulled muscle, not his heart. But Marcus still spent time explaining everything, making sure Deshaun understood what to watch for, when to come back, and how to take care of himself. "Thank you for taking me seriously," Deshaun said as he was getting ready to leave. "I was worried you'd think I was wasting your time." "You're never wasting my time when you're concerned about your health," Marcus said firmly. "Always listen to your body. Always speak up. And if any doctor ever makes you feel like your concerns don't matter, find a different doctor. You deserve to be heard." After Deshaun left, Marcus sat down at the nurse's station to finish his paperwork. His colleague, Dr. Jennifer Martinez, came over with coffee. "I saw how much time you spent with that patient," she said. "He's lucky to have you." Marcus smiled. "I'm just doing what every doctor should do. Listening, caring, treating patients like human beings who deserve respect." "Not every doctor learned that lesson from what happened last year," Jennifer said quietly. "But a lot of us did. Your case changed things here. People are more aware now. They're more careful about their own biases." It was true. The ripple effects from the hearing had spread throughout the medical community. St. Augustine Medical Center had become known as the hospital that had failed its patients, but then worked hard to fix its mistakes. Their reforms had become a model for other hospitals. The mandatory bias training that Dr. Harper had recommended was now standard at hospitals throughout the region. The training wasn't perfect, but it started important conversations. Doctors talked about how unconscious prejudices could affect their medical decisions. They shared examples of times they had made assumptions based on race. They learned to recognize and challenge their own biases. The Independent Patient Advocacy Office at St. Augustine was making a real difference. Patients now had a way to report concerns that didn't go through hospital administration. The advocates reported directly to a community oversight board that included former patients and local leaders. Complaints were taken seriously and investigated thoroughly. Marcus had been invited to join that oversight board. Once a month, he attended meetings where they reviewed patient complaints, looked at outcome data, and discussed ways to improve care. It was time-consuming work, but it mattered. At one meeting, they reviewed a complaint from a Hispanic patient who felt her pain had been undertreated after surgery. The board investigated and found that the surgeon had indeed provided less pain medication than he typically gave to white patients with similar procedures. When confronted with the data, the surgeon was shocked. He hadn't realized his own bias was affecting his prescribing decisions. "I never thought of myself as prejudiced," the surgeon had said. "But the numbers don't lie. I was undertreating pain in my Hispanic patients without even realizing it." The surgeon went through additional training and began tracking his own prescribing patterns to make sure he was treating all patients equally. It was a small victory, but Marcus had learned that real change happened through many small victories. The wrongful death lawsuit filed by Thomas Richards' family had been settled for a large amount. More importantly, the settlement required the hospital to create a memorial scholarship in Thomas's name for students from underserved communities who wanted to pursue careers in healthcare. Every year, 3 students received full scholarships to medical school, nursing school, or other health profession programs. Angela Richards, Thomas's daughter, was involved in selecting the scholarship recipients. She told Marcus that the scholarship helped her feel like her father's death had meaning, like some good had come from their terrible loss. "My father didn't die for nothing," Angela said. "Because of what happened to him and because of you speaking up, the system is changing. Students from communities like ours are becoming doctors and nurses. They'll remember what happened to my father, and they'll treat their patients better." Dr. Pemberton's medical license had been permanently revoked. The state medical board had found multiple violations of medical ethics and standards of care. He would never practice medicine again. His wife, Margaret, had been charged with obstruction of justice and official misconduct. She pleaded guilty to lesser charges and received probation, but the scandal had destroyed both of their reputations. Marcus tried not to take satisfaction in their downfall. What mattered wasn't revenge, but preventing future harm. Still, he couldn't help feeling that justice had been served. The 5 patients whose complaints Margaret Pemberton had buried were contacted by the hospital. They were offered apologies, financial compensation, and the opportunity to have their complaints properly investigated. 2 of them ended up filing their own lawsuits. The others accepted settlements. All of them expressed relief that they had finally been heard and believed. Marcus stayed in touch with James, Patricia, and Robert. The 4 of them had formed a bond through their shared experience. They met for dinner every few months, supporting each other and discussing their ongoing work in patient advocacy. James had fully recovered from his heart attack and was back to teaching full-time. He had started a health education program at his school, teaching teenagers about heart disease, the importance of advocating for yourself in medical settings, and how to recognize signs of discrimination in healthcare. Patricia's law firm had created a pro bono program to help patients file complaints against doctors who provided discriminatory care. She personally handled several cases, using her legal expertise to help people navigate the complicated complaint process. Robert had become something of a celebrity in the senior community. He spoke at retirement centers and community centers, sharing his story and encouraging older adults to speak up for themselves. "We've lived too long and worked too hard to let anyone treat us with disrespect," he would tell his audiences. "Demand the care you deserve." Marcus's own advocacy work had expanded beyond the oversight board. He was now part of a national committee working to develop better standards for identifying and addressing racial bias in medical care. They were creating guidelines that hospitals could use to audit their own practices and measure whether patients of all races were receiving equal care. The work was slow and sometimes frustrating. Changing a system as large and complex as healthcare felt like trying to move a mountain, but Marcus had learned that persistence mattered. Every policy change, every training session, every doctor who became more aware of their biases was progress. On the anniversary of the hearing, Marcus visited Thomas Richards' grave. He brought flowers and stood there for a long time, thinking about the man who had died because a doctor wouldn't believe him. "I'm sorry we couldn't save you," Marcus said quietly to the gravestone, "but I promise you your death is making a difference. Things are changing. Slowly, but they're changing." As he stood there, Marcus thought about his own near-death experience. If he hadn't sought a second opinion, if he had just taken those anxiety pills and gone home, he might be dead too. He had been lucky. But luck shouldn't determine whether patients receive good medical care. Every patient deserved a doctor who would listen. Every patient deserved thorough examination and appropriate treatment. Every patient deserved to be seen as a human being worthy of respect, regardless of their race, their background, or their circumstances. That evening, Marcus was scheduled to give another talk, this time at a medical school. He stood before a room full of first-year medical students, young people just beginning their journeys to become doctors. "You're entering medicine at an important time," Marcus told them. "We're finally starting to have honest conversations about racial bias in healthcare. We're acknowledging that the system hasn't worked equally well for all patients, and we're trying to fix it." He shared his story with them, not leaving out any details. He wanted them to understand how dangerous bias could be, how it could lead to missed diagnoses, inadequate treatment, and preventable deaths. "Some of you might be thinking that you would never make these mistakes," Marcus said. "You might believe you're not prejudiced. But bias isn't always conscious or intentional. It's shaped by the society we live in, the media we consume, the experiences we've had. Everyone has biases. The question is whether you're willing to examine yours and work to overcome them." He talked about the importance of spending adequate time with every patient, of listening carefully, of not making assumptions based on race or appearance. He emphasized the need to look at data and outcomes, to make sure they weren't unconsciously providing better care to some patients than others. "You have the power to change this system," Marcus told the students. "Every interaction you have with a patient is an opportunity to provide excellent, equitable care. Every time you catch yourself making an assumption, you can pause and reconsider. Every time you see a colleague providing biased care, you can speak up." After his talk, several students came up to thank him. A young black woman named Keisha told him that his story had inspired her to go to medical school in the first place. "I've had experiences like yours," she said. "Times when doctors didn't take me seriously or made assumptions about me based on my race. I decided I wanted to become the kind of doctor I wished I had. Your story reminds me why this work is so important." Marcus felt proud listening to her. The next generation of doctors would be better prepared to provide equitable care. They were learning about bias and discrimination in their training, not just discovering it through painful experience later. As Marcus drove home that night, he thought about everything that had changed in the past year. Dr. Pemberton was gone from medicine. The hospital had reformed its policies. Training programs were addressing bias more directly. Patient advocacy organizations were helping people speak up. And doctors like Keisha were entering the profession with commitment to treating all patients with dignity. The fight wasn't over. Racial bias in healthcare didn't begin with Dr. Pemberton, and it didn't end with his suspension. There were still too many patients being dismissed, too many symptoms being minimized, too many lives being put at risk because of prejudice. But something had shifted. People were paying attention now. Institutions were changing, and patients were finding their voices. Marcus thought about Deshaun, the young man he had treated earlier that day. Deshaun had come to the emergency room expecting to be dismissed, but instead he had been heard and cared for properly. That was progress. Small progress, maybe, but real. Every patient Marcus treated with respect and dignity was a step toward the kind of healthcare system he wanted to see. Every time he listened carefully and provided thorough care, he was living out the values he believed all doctors should hold. When Marcus arrived home, his wife hugged him tightly. "Long day?" she asked. "Good day," Marcus replied. "I gave a talk at the medical school. The students really seem to get it. They understand what we're fighting for. I'm proud of you," she said. "What you did took courage. Speaking up when it would have been easier to stay quiet. Fighting when you could have just moved on. You've made a real difference," Marcus smiled. "We all made a difference. Me, James, Patricia, Robert. Every patient who spoke up. Every witness who testified. Every doctor who started examining their own biases. It wasn't just me. It was all of us together. That was the real lesson from everything that had happened. One voice speaking up was important, but it could be dismissed. Many voices speaking together created a pattern that couldn't be ignored. Change happened when people refused to stay silent, when they supported each other, when they demanded accountability. Marcus's story became part of medical education. His case was taught in schools across the country as an example of how bias could affect medical care and how patients could advocate for themselves. The audio recordings from his appointment with Dr. Pemberton were used in training sessions to help doctors recognize discriminatory communication patterns. Some people criticized the use of these recordings, saying they were too harsh or made doctors look bad. But Marcus disagreed. Doctors needed to hear how their words sounded to patients. They needed to understand the impact of dismissive language and prejudiced assumptions. Years later, Marcus would still meet people who told him that his story had changed their lives. A doctor who said hearing about his case had made them examine their own practice more carefully. A patient who said his example had given them courage to seek a second opinion. A medical student who decided to specialize in serving underserved communities because of his story. Each of these conversations reminded Marcus why the fight had been worth it. Speaking up had been scary. Going through the hearing had been painful. Dealing with the media attention and the criticism had been exhausting. But the outcome, the changes that resulted, made all of it worthwhile. Marcus never forgot how close he had come to dying. Every day when he went to work in the emergency room, he remembered that he was alive because he had trusted his instincts, sought a second opinion, and demanded better care. He remembered Thomas Richards, who hadn't gotten that second chance, and so Marcus continued his work. He treated every patient with care and respect. He served on the oversight board. He gave talks and trained other doctors. He mentored young physicians. He advocated for policy changes. He supported patient advocacy organizations. The work would never truly be done. There would always be more to do, more problems to address, more changes to push for. But Marcus had learned that even one person could make a difference. Even one voice speaking up could start a wave of change. Standing in the emergency room, treating patients who trusted him with their lives, Marcus felt grateful. Grateful to be alive. Grateful for the opportunity to make healthcare better. Grateful for the patients who had stood with him. Grateful for the changes they had created together. This was what justice looked like, not just punishing wrongdoing, but transforming systems so they worked better for everyone. Not just holding one doctor accountable, but changing how all doctors approached their work. Not just saving one life, but creating conditions where every life was valued equally. Marcus picked up the next patient chart and headed to the exam room. There was work to do, patients to care for, and a better future to build, one patient interaction at a time.